after reviewing a lot of the things that I want to talk about tonight, I think I pretty much figured out that as a physical therapist, this is probably one of my favorite topics to talk about, the neck and the cervical spine. I'm really excited to come to you tonight with some more information about the neck and different problems that we do have with the neck. So for those of you who have not turned in, my name is Todd Thoughton from Thoughton Physical Therapy, and I own Thoughton Physical Therapy here in Attleboro, Massachusetts. I'm very active. I love to race triathlons. I love to work out. So for me, being active is a very important part, should be a very important part of everyone's life. And as for me as a physical therapist, through my eyes, I really believe that people should continue to do what they want to do through any treatment sessions that they need. I've been a physical therapist for over 20 years, and I've had a pleasure of working with amazing physical therapists. I treat patients about 20 hours a week, and I run the business 24/7. For those of you as business owners, you know that that's what happens. I'm really passionate about what I do. So my passion as a physical therapist to ease suffering to all my friends, to my family, any of my clients that I may have that come through our doors. My real portion while being a physical therapist is to work on the mindset piece of helping people through the physical therapy treatments. As we know, it's only 1 to 2% change that really makes all the difference in any part of anyone's life, but especially in the physical therapy, it's doing the same consistent things that your physical therapist is going to want you to do over time that's really going to reap the biggest benefits. My purpose of Facebook Live is to have the biggest reach possible to as many people as possible, knowing that as a physical therapist I can only help so many people. But I'm hoping with this that I'll be able to reach more people and give away more information for anybody that might have any questions, again, especially with tonight's topic, the neck. To me, again, when I started off the Facebook Live tonight, one of my things that I have noticed is that the neck is involved with everything. So if we have the head and the brain, and we have the whole spinal cord, everyone knows that if someone has a spinal cord injury, it can affect everything from the neck down. Well, that goes true, I believe, through my research and by treating many patients over the years, that even the neck can cause involvement with the shoulder, with the upper back, with the low back, and anything with the lower extremity. So I feel that the neck is a really, really good place to start. And again, it's something that I treat with all my patients that come in right now. To go over the basic anatomy, we have the vertebrae and the cervical spine. It's made up of 7 vertebrae. And in between each of the vertebrae, we have the discs. And along each side of the discs, we have the nerves. The muscles that we commonly talk about are the upper trapezius muscles. We have some of the scalene muscles in the neck. We have some of the paraspinal muscles which run up the side of the neck. We have the pectoralis muscles. And then we have the lats and the low back muscles. All those play a really important role affecting the number one thing that I see that people really need to address is their posture. So what I first want to talk about today was just a couple different types of neck injuries that we may see. When someone has a neck strain, the first thing would be a neck strain, and that is often called whiplash, and it's a damage to the muscles or tendons. And some of the signs and symptoms that you may notice with that is weakness in both arms or one arm. You may have some numbness. You may have loss of function. You may have headaches. You may have nausea, vomiting, difficulty swallowing, maybe difficulty breathing. The causes could be from poor posture, from lifting incorrectly, from repetitive work, and any sport or hobby-related activities that may have caused a strain. The treatment for a neck strain would be, the most important part is to find out the starting point. And by that I mean is do a good assessment with the person right off the bat to see how the range of motion is, to take a look at their posture, and really listen to the person to see what was the mechanism that caused the injury. So as we're progressing through the treatment, that we can help the patient with the do's and the don'ts so they don't come into the same problem again. We do physical therapy for postural exercises. We'll do some hands-on manual techniques to the neck, to the upper back, to the shoulders. And the biggest thing is the patient education. The next type of injury is a neck sprain, S-P-R-A-I-N, which is when the patient has a tearing of the ligaments, And ligaments, what the job is, if we have the bones in the neck along the spine, the ligaments hold bones in place for the body, which give the body structure. So if we have tear in the ligaments, this takes a little bit longer to heal. Ligaments can take anywhere from 6 to 8 weeks to heal. The signs and symptoms of a sprain would be that the pain does get worse with motion. We have neck stiffness and also a decrease in the range of motion, muscle spasm, pain in the upper back, pain in the shoulders, headaches along the back of the head. You can also have sore throat, ringing in the ears, and some dizziness. The cause of that is usually a trauma. It could be a slip and fall when there's been some type of impact, whiplash type injury in a car. And again, what would be the treatment for a neck sprain? Kind of the same points for a neck strain, which would be we want to do a thorough assessment to see where the patient is at, see where the range of motion is at, see are they activating the right muscles in the cervical spine, make sure that they're not compensating. The next type of injury would be a bulging disc. So we have the vertebrae, and in between the vertebrae are the discs. When we bend forward, the disc wants to push out backwards. When we come side to side, the disc wants to push out to either side. And we see what happens with a bulging disc is the bulging disc can come and push on the nerve. And we know the nerves do three things, especially from the last couple talks that we've had. The nerves they allow pain response, they allow a sensation response, and they also give juice to the muscles to work. So those are the three important things that a nerve does. So if we have a bulging disc, it can push on the nerve, which can give us pain down into the arm. It can give us sensation changes, numbness or tingling. It can also give us a lack of power to the muscles in the upper body. One of the treatments for the bulging disc, all the treatments are going to be the same. We want to take a look to find where the patient's starting point is at. We want to address their posture. We want to find out what is the mechanism that caused this. But the biggest difference with the bulging disc is we really want to avoid flexion exercises in which we bend our head forward, because any flexion exercises can cause the disc to bulge out a little bit more, which can cause more pain, numbness, tingling down the arm. The other thing that we want to work on is extension exercises. By doing extension exercises to strengthen the back of the neck as well, that's going to be a big piece of working with the bulging disc. The next thing, if that isn't enough, is a herniated disc. So when we have a bulging disc that bulges, it kind of bulges in, bulges out. Eventually, the tissues that hold the disc in place can kind of almost have a blowout. And when that happens, we have some of the fluid from the disc space comes out, hits the nerve, and that can be something that's a lot more painful. We're going to get a lot of the same symptoms as your bulging disc, but the pain is usually intensified. A lot of times we'll have even more weakness down the arm. We're going to have more numbness and tingling down the arm. And if we do not treat that with prolonged issues with a herniated disc, we can have permanent nerve damage, which can, as we know, can affect with significant amount of pain, permanent sensation changes, and also more permanent weakness in the upper body. The second to last one is called spinal stenosis. Stenosis means a narrowing of the cavity. So when we have spinal stenosis in the neck, knowing that we have the spinal column and where some of the nerves come out, is if the space where the nerves go is a little bit tighter, that can cause more pinching of the nerves, which will give us more symptoms of the bulging disc and the herniated disc. But again, the symptoms are even more intense. Usually if someone has spinal stenosis, it doesn't mean that they're going to need surgery, but a lot of times we do have to send them to maybe an orthopedic doctor or a neurosurgeon to see if there's anything they can do. They might use some steroid injections if the physical therapy does not work. In the worst case, they might need surgery to kind of clean out the hole just so there's more space for the nerve. One of the most common ones is called the pinch nerve. This is something that commonly most people read about and they hear about, and we're going to equate that to what does a nerve do? It gives you pain response, sensation response, and it's also going to give you a change in the juice to the muscles or the power source. So if we have a pinched nerve, it can affect any of those three or all three at the same time. The signs and symptoms, again, could be sharp pain, aching pain, numbness, loss of strength, and definitely power changes with that loss of strength. The causes for a pinched nerve are usually postural changes. It could be some type of trauma, but it's usually some repetitive use over, or some repetitive trauma, or some repetitive injuries over time. Other things that can cause neck pain that we really want to pay attention to are seasonal allergies, which can give you a sore throat, a viral infection, strep throat, lymph inflammation, and maybe even a cerebral spinal fluid leak, which is something along the spinal cord. For myself as a physical therapist, whether patients are coming in for any one of these injuries, I'm going to do the same things that I'm going to do in the same sequence that I always do for all my patients. The first thing, it sounds silly, but I need to do a thorough assessment. A lot of the patients come to see me. I've been other places and haven't gotten better, so I really need to take a really detailed history at the beginning, especially with the cervical spine and the neck. I need to assess the upper back mobility. I need to assess the neck mobility, and I really need to assess to see what the strength is of the cervical spine. I'm finding with a lot of the postural changes, because so many people spend a lot of time typing, spend a lot of time on the phone, they're kind of slouched over. And if we think of the body like an engineering structure in which the head has to be over the shoulders, the head has to be over the neck, which is over the shoulders, and all the way down the chain. And when that is out of alignment, that's when we can get changes with the nerve. We can get pinching with the nerve, which again changes all the symptoms. So that's the first thing, do a thorough assessment. The second thing as a physical therapist is I really address people's posture. The posture is the most simple thing that people can do, whether you're at work, whether you're driving in a car, very, very important. Through working on the posture, we need to turn on the fuse box by activating the right muscles. And by activating the right muscles, we're going to develop strength all the way down to both hands, which will allow us to have the most amount of strength and avoid overuse injuries. Along with the posture, I never really have people stretch because it's been through my eyes, through the last couple of years of beta testing, thousands of patients that muscles are tight for a reason. If there's an imbalance and if I haven't activated the right muscles, other muscles are going to be tight. But if I work on the posture and work on activating the right muscles along the neck and along the spine, the tight muscles should just relax. So for me, Todd's words to live by, the buy-in. I want to educate the patient right from the beginning to let them know what the diagnosis is and let them know what I can do for them, that less is more. By working on the home exercise program, I don't want to overwhelm the patient with so many exercises that they're not going to do them. So I try and keep it to under 5 to 10 minutes for multiple times throughout the day. And let them also know that everything is just going to be a 1% to 2% change. And by doing that over time, whatever injury that they're coming in for is going to get better. We know that posture is not anything that we have developed bad posture overnight. So the changes are going to be also it's not going to happen right away. So we want to make those changes over time. So one of the questions that we have is, I have a vertebrae that sticks out more than the others, but it doesn't hurt. Should I be concerned about that? What could it be? As we feel along, so a vertebrae are the bones on the back, the bones along your spine. So if we feel along the back of our spine, you can feel the bumps that stick out. A lot of times people, before they even notice that they have any issues with their body, most people haven't even taken an assessment to feel if one sticks out more than the other. As we feel down from the base of your head, all the way down to your neck, you will feel one of the first ones that sticks out a little bit more. That is normal as the junction from your neck goes to your mid-back, that one of those does sticks out. If it's something that's not painful, I wouldn't be too concerned about it, but it is something that you do want to monitor to change to see if it does change and if you can associate inner pain or any loss of mobility with it. Question from Janet. Can you recommend any exercises for prevention? One of the biggest things that I'm finding with posture when I talk about the fuse box is to turn on the muscles in the lower body. How do we turn on for the upper body? How do we turn on the muscles for the upper body is we need to have good control of our neck and control of the stability muscles. Someone might have strength in their arm, but they'll notice when they put their head down or when they put their head up, it changes the strength in their hands, their elbow, or their shoulder. So if we can do deep neck muscle strengthening exercises so you can hold the postural position as you're producing a force, that will make a big difference. One of these exercises that's very simple to do. If you picture you're lying flat on your back, we want to do a chin tuck when we're tucking our chin down a little bit, and then we lift our head about 1 inch or 2 inches off the table. I'll say 1 inch works really good. So we should be able to do a chin tuck and hold your head up, and the goal would be to hold it up for a minute. When we hold it for about 5 seconds after doing the chin tuck, we're starting to get the muscles working, but it's more of the superficial muscles. So we want to get the deep muscles working because that's going to stabilize the neck and the spine, which is what we really want to accomplish. So we would start off just by lying on your back, just doing a chin tuck. Once we can get up to holding for about 30 seconds, then we can add in the chin tuck and lifting your head off the table. Just even by activating that, you will notice a big increase in strength in your arms. So that's a simple exercise to do because we do spend so much time in different neck positions. Or if you have a job, say for example, a painter, when you're looking up a lot, it's important to have a balance. So if we're working on your neck looking up, well, we need to work on the muscles on the front of your spine. So that's where I would start. It's a great exercise to start with, and you will notice it has a big return on investment. Thank you for the question, Janet. The next question is, I have a desk job and my elbow bothers me throughout the day. I went to physical therapy for tennis elbow and I only feel I am 50 to 60% better. What else can I do? That's a great question. That's something, I had a patient that came in this afternoon, a teenager, and her mom came in today. And she told me that she had some tennis elbow, which is one of the talks that we had before. So I asked her just a few questions about her tennis elbow, and I asked her if she had any neck pain, and she said she did have neck pain on the same side as the tennis elbow. A lot of times when someone comes in for tennis elbow, if someone goes to physical therapy for tennis elbow, if they're just treating the tennis elbow, to me they're really missing the boat. I can say with 100% certainty that any issue related to the upper extremity anywhere is related to the neck, and that's always the place to start. So I think the reason why, I'm not surprised the reason why your tennis elbow only got 50, 60% better, because they probably didn't take a look at your neck. So I would have them, if you're going to go back, I'd have them take a look at your neck. Certain areas of your shoulder, in your arm, your elbow, and your hand are related to the disc issues, the disc levels in your neck. So if we could do some neck stability exercises, also working on how the neck and the upper back move, I think you'll see a big improvement there. So that's what I'm guessing. They didn't clear your neck or your cervical spine, and that's why you're still having issues with your elbow. That's a great question. The next question, sometimes I have numbness from the neck down the back of my arm. What could this be, and what can I do? Well, we know that nerves do three things. They give us a pain response. Second thing is they give a sensation, which could be numbness or tingling or feeling fine. And the third thing is enough juice to the muscles to work. So if you're having numbness down the back of your arm, I would definitely take a look at your neck and definitely look at your posture. That's one of the things that can definitely cause symptoms down into your arm. And that could be related to, you might have a muscle spasm that's pinching around one of the nerves that goes down. So it could just be a muscle spasm issue. It could be a bulging disc issue. It could be a herniated disc issue. But it's definitely something you want to look at your posture. I would pay attention to what are you doing throughout the day that changes those symptoms. If you're sitting up for a while and if it bothers it, or if you're sitting at, maybe if it's after you're on the phone or you're at your computer, I would definitely look for what changes throughout the day do increase that numbness. It's just great to gather as much information as you can, so when you go see a physical therapist, you can give them that information and they can come up with the best treatment plan for you. I wake up in the middle of the night and my hands are numb. My doctor wants to send me for a nerve test. Do I really need to have that done? That brings up a really important point. If you're waking up and if your hands are numb, I'm thinking one of the things that we'd want to address with you is your posture when you're sleeping. So not only is your posture important when you're seated at the office or working, or whether you're doing activity or hiking or driving, your posture is really important when you're sleeping. When you've had a poor posture when you're sleeping for a long period of time, that can, again, if you have a bulging disc issue, it can bulge out the disc, which can hit the nerve, or just even the tension on the nerve can send pain response, sensation changes, or not enough juice to the muscles to work. Some of the things you want to think about when you're in the sleeping posture is you want to have your neck in good alignment. So you want to have your neck straight up, So you want to have your pillow supported enough where it supports your neck, also supports your head, but so you're not sleeping with your head tilted, or you're not sleeping with your head rotated, or not sleeping with your head in the crow fetal position. So from a position of your posture, you want your head to be in alignment vertically. I should say you want to have it from the plane, the side plane, as well as straight on. So supporting your neck and the back, if you like to sleep on your back, or on your side, you want to have your neck supported on whatever side you sleep on. I find the best position to sleep is either going to be on your back with a pillow underneath your legs, or on your side with the pillow supporting your neck. My neck is really sore in the morning. How do I know I have the right pillow? Again, that's a really good question. Kind of along the lines of just answering the question, the last one that we just talked about. The biggest thing is you want to have with the pillow, to go in a little bit more depth, you want to have the pillow being supportive enough where even throughout the night it doesn't get too soft, or it doesn't squish in too much where you wake up and your head is in a tilted position or your head is rotated. You want to, if you're going to lie on your side, it's really good to have a pillow where you can position your arm over, because you don't want your upper back or your shoulders to rotate forward or back, which are going to also add to having your neck in a position where it's flexed forward. So have a pillow that's soft enough. Some of the memory foam pillows really work. You can also just take a normal pillow, put a towel roll, wrap it up, and put the towel roll inside the pillow that is going to support your neck. Because the most important thing is to have your neck supported, whether it's if you're lying on your back or whether it's lying on your side. Very important to have your neck supported. The next question, I'm 58 years old, and it seems the top of my spine, the base of my neck, is developing a hump. Could this be osteoarthritis? Can anything be done to help it? That's a really important question. As we know, the most important part for any patient that comes in the door for physical therapy is really to address their posture. And if you're starting to notice a hump developing on, I assume, your mid-back, that would be something that you definitely want to address as soon as you can. Are you going to make big changes where you might lose the hump? Probably not. But what we really want to think about is we don't want your symptoms to get worse. So like everything else, we would want to work on keeping your shoulders back in good position, keeping your head as much as you can over your neck, over your shoulders, because anytime when your head comes forward, it's going to change the position of your body. It's going to change the position of the vertebrae, which is going to change the positions of the nerve, change your pain response, change your sensation, and potentially change the strength in your arms. So posture is the most important thing, and you really can make a change with that. You can make some changes in your car seat. You can make some changes at your workstation, making sure that your hands are in the right position, make sure your monitor is the right height. Some really important, some ergonomic changes that you can make. Well, I want to thank everybody for tuning in tonight. I really enjoy talking about the neck, because I know, again, that the neck is related to 100% of any injury or any issues you have going on with any arm issues, as well as that it's also related, that I found through my research, to commonly related to a lot of any lower extremity injuries. So if you're treating for a knee pain or an ankle injury, or even a hip or low back injury, and then not really getting better, I would really have someone investigate your neck and your cervical spine. Thank you again for tuning in. We look forward to, actually next week, we're excited about, we have Don is going to be coming in. He's going to be talking about TMJ next week, which is, again, a really, really hot topic. So we're excited to have Don on as a special guest. If you have any questions, please feel free to reach out to me at todd@houghtonphysicaltherapy.com, or you can also private message me, and I'll definitely get back to you. If I need to get back to you, we can text back and forth private message, or we can even talk on the phone. I'm here to help you guys out in any way that I can, and I just want to share and spread the knowledge to make people just aware of what physical therapy can do for them. So thank you very much. I'm really excited again to have another great episode, and we're looking forward to seeing you here next week. Thank you. Have a good night.